Bridges historically is a term used to describe a fixed replacement for missing teeth using one's own teeth. So historically, that would classically be a tooth either side of a space would be prepared for a crown, a full coverage crown, and that bridge would then be cemented on to replace the missing teeth. However, that does mean preparing the supporting teeth. And so sometimes we can use implants to provide more than one missing tooth, and that becomes an implant bridge. And generally, that would be implants on either side of a space. So if there's a 3-tooth gap, you could put 2 implants in rather than having to put 3 implants in. And on those 2 implants, you could support a 3-unit bridge. Bridges are generally required to replace missing teeth. And most patients, if at all possible, would prefer to have a fixed solution. So that's something that doesn't come in and out like a denture. And so bridges are useful to provide a fixed solution, whether they be supported on natural teeth or on implants. The natural teeth, if they've been restored previously, would be good candidates. But what we would like to try and avoid most of the time is preparing a healthy virgin tooth for a full coverage crown, because it's relatively destructive of that natural tooth. And if we can provide a missing tooth with dental implants, we don't need to do anything to the neighboring teeth. Any patient can make a good candidate for bridge work as long as they're prepared to have the procedure completed and would prefer to have a fixed solution rather than a removable solution. Smokers have a slightly higher risk, and obviously smoking is detrimental to one's general health and detrimental to one's oral health, especially with regards to gum disease. But even with smokers done correctly, we can still place implants, although we would always advise avoiding as much as possible. Other than that, there are very few people who aren't good candidates for bridges, be they supported on teeth or implants. All-on-4 is now a recognized treatment to replace a whole arch of missing teeth just supported on 4 implants. Again, it's important to not be too aggressive and take out teeth that are otherwise saved, because implants work very, very well, but they're not without their problems in that one can still get gum disease around implants. And so if teeth are savable and have a good outlook, a good prognosis, we'd always prefer to save those teeth. However, there comes the time where teeth sometimes aren't savable. They've had a lot of restorative work done to them and beyond being restored again, or there's been so much gum disease that there's no supporting bone. And traditionally, that would have meant maybe either having a full denture or having a large number of dental implants. But we now know that we can provide a fixed bridge on 4 dental implants. And classically, with an all-on-4, that is 2 implants at the front and 2 implants at the back that are angled to avoid the sinus and also avoid a distal cantilever coming off that last implant. And so we can transition people from having no teeth to having a fixed transitional bridge on the same day, and sometimes that's called teeth in a day. That is a temporary bridge that's made until all of the soft tissue and the bone has healed, and then we can make a permanent bridge, which is much stronger, that's fixed on all implants, on the all-on-4. And all-on-4 has even progressed further now that people who have very little bone left in their jaws can still have all-on-4 with some zygomatic implants. So that's implants that go into the cheekbone. And there is a procedure also called a quadzygoma, where people have virtually no bone in their top jaw, can still have an all-on-4 supported on 4 zygomatic implants. We have other solutions. We can have pterygoid implants, which go back into the pterygoid bone, or even nasalis implants that go into the bone at the floor of the nose. So sometimes people say, well, I have no bone, I can't have implants. There are many procedures that allow us to provide nearly everyone with a fixed solution, if that is what they would prefer, which most people do. And classically, that's called all-on-4. Sometimes it might be possible to place slightly more implants, all-on-6. And even one can go further than that and place 8 implants and provide 4 3-unit bridges to replace all the teeth. But generally, all on 4 allows a quicker solution without having to do as much dentistry, and therefore can often be cheaper than the alternatives of providing other full arch restorations.